Joining me on Startup Report, we're continuing to dig into the members of the Tampa Bay Wave Tech Diversity Accelerator, supported by Nielsen. And today we have Shalen De Silva from Vincere Health. Welcome.
Hi, Joe. Nice to meet you.
And you're up in Boston, Mass?
Yep, that's right. Up north.
Very nice. So first, I got to say your marketing is incredible, because when I went to your website and pulled it up, Vincere.health, the first thing it said was "Welcome back, Joe." And I'm assuming that's not just a random name you put up there. Was that customized for me? You know, I was visiting it today.
No, that's purely coincidence.
Purely coincidence. Oh, all right. Well, I take that back then. But no, that was funny. So let's talk about Vincere Health. How are you getting folks to quit smoking? And then looks like there's some payback from the insurance company if they're successful.
Yeah, so it's a telehealth platform that pays you to not just quit, but just to participate in the counseling program. We are licensed as a telehealth provider, so we can bill your insurance company directly. And yeah, we cut you a check just for engaging in the program and achieving certain objectives along the way.
That's great. So what are the numbers behind the savings that an insurance company thinks that they can achieve by getting someone to quit smoking, and that they're willing to pay back for them to do so?
Yeah, so insurers spend about $170 billion a year on covering smoking-related health costs. And there's a ton of evidence and data out there, literature around how a smoker costs about $2,000 to $3,500 a year to insure, $6,000 if you take into account productivity losses if you're a self-insured employer, for example. So hugely costly problem, well understood at a population level with a lot of research. I think the way we're approaching it is we're getting reimbursements for providing the services, the counseling services, and the monitoring services around this fee-for-service model to begin with. The reimbursements are not super generous, but when you're a purely virtual program with no brick-and-mortar overheads, we can achieve good profitability, 60-70% profitability at scale. And the idea that insurers provide reimbursement codes and billing opportunities for just preventative services, irrespective of someone quitting, is because there's so much evidence that just getting them exposed to that counseling and the idea of going through a quit journey is likely to make a significant proportion of them quit.
Assuming there are stats also around number of quit journeys too. So maybe the third one is more likely to be successful than the first one. And so even starting the process, that's where that value starts to stack up.
Exactly. So I think on average, the data varies. I think there's a range from between 3 to 7 times 7 quit attempts for people to actually succeed. So no one expects you to quit in your first attempt. Sometimes you have to keep trying, and the more you try, the higher the chance of you succeeding. And what we do is expose you to the counseling and the standard of care provided by a human counselor, so that you're able to ask yourself the necessary questions to prepare your mind to make that change. You have to make the choice for yourself, and we give you the opportunity. And we sweeten the deal a little bit to bring you to the table with the incentives.
Yeah, and speaking of those incentives, when you overlay that onto an addressable market, obviously there's plenty of people that are smoking. There's some subset of those that are interested in quitting. And when you speak to that subset that's interested, do you find that the biggest driver, the straight cashback reward, is where you're really leading, or are you trying to put forth a comprehensive sort of assault on all of their sensibilities as to why they should quit?
Yeah, I mean, you raise a great point. I think we're trying to figure out really how do we convey this very helpful, valuable proposition in the simplest format to speak to everyone. Because fundamentally, if you're a smoker, this is a free service. You are getting paid, not a crazy amount of money, but something, and you're getting access to qualified healthcare professionals who will consistently be there for you throughout that journey. And all of this covered by your health plan, because every health plan is required to offer smoking cessation services. Now, not everyone cares about the money in the same way. I think it's nice to get paid, but ultimately the real driving force behind quitting is you making the choice for yourself. And but the money is a nice little sweetener to get people through the door and just do the kind of steps necessary to get into the habit of turning up to your counseling and asking yourself these questions.
Right. There's probably a strange, the hurdle gets a lot lower when you have the freedom to not be paid on outcome, but just participation as well. Can't hurt.
Exactly, yeah. So our incentive platform's very flexible. The counselor would almost uh, create an incentive plan together with you to based on what really makes the most sense and how best you're motivated. But ultimately, it's not punitive. Where it's there to encourage you to keep forming a habit away from the smoking and towards making better, healthier choices in little bite-sized forms along the way. So there's incentives aligned to participating, and there's also bonuses aligned to actually quitting or reducing your smoking level along the way.
What hopes would one have for verification on that? Most of the times it's just a checkbox on a form. Is the in general, are the insurance companies just happy with self-reporting, or are they asking you for more than that?
So what's cool about what we've built is it's a device that can measure your smoking level that pairs with your phone. So we send you, when you sign up, we send you a box with a little carbon monoxide breathalyzer type sensor. It connects with the mobile app that we've built, and you blow into the device. It can tell how much you've been smoking, and the rewards are customized based on the threshold that we set. And if it's just participation, you get a reward just for generating a result and blowing into the device. And that becomes something you can measure. We find that people really enjoy the first time they do that breath test. It's the surprise that they can actually measure the harmful gas going into their body. And as they start to make the changes, the positive changes in their life, and they see the results going down and the trend line going in the right direction, it's motivating. It's kind of reinforcing of the work that they're doing. And we're also verifying objectively that they are reducing their improving their outcomes.
That's great. And I saw on the site that people could opt in and just, participate themselves if they weren't attached to an insurance company. So are you acquiring customers just, through your own means, or do you mainly go through and communicate with self-identified smokers through the insurance plans?
So we can help people who come in independently, but often we would need them to be insured, whether it's Medicaid or some kind of health plan. Even if it's a high deductible health plan, we can serve them in the states that we're licensed in. But we also have strategic partners who do pay us just a fee for helping the constituents that they're responsible for, and that's outside of the insurance model.
With that, then that sort of takes the burden off of the acquisition cost, because once you're taking out the cost of sending out the device and paying out a percentage of the, as you had mentioned, not so generous reimbursements, to achieve those margins that are acceptable, then you really have to rely on the insurance companies for a lot of your acquisition.
Yeah, I mean, I think acquisition wise, we've seen it's not very costly even to reach people directly through digital marketing, but we have strategic partners who, by nature of the work that they do, state agencies, health systems, they see smokers day in, day out, and for them, it's very easy to punt them off to us.
Got it. And as from a retention standpoint, you mentioned 3 to 7 times to be successful. What are your estimates or what are your projections for how many people will participate in the program more than once?
Yeah, I mean, I imagine the majority of our participants will probably need to go through 2 or 3 quit attempts at least. We see success in the period that we're able to help them. But then, we can't offer counseling forever. there's a limit in the number of counseling sessions we can provide in the year. But beyond that, we hope the community can offer the support that's necessary. But sometimes there are the things that come up in your life that you can't predict and might sort of send you off on the wrong path, and you need a little bit more help. And we're there every time. We can still kind of offer that service every year if you need to come back. And
Got it. So what was the catalyst for starting this business?
yeah, I guess it's a long story. I used to work in finance myself. I was a investment banker for about 10 years. I worked in sort of Singapore and London, but I helped co-found a medical outreach NGO while I was working in Singapore. I always had a yearning to want to contribute more and do more with my kind of skills rather than just be a cog in the wheel and a large corporate. Um, Co-founded this NGO, took me around Asia, serving underserved communities with cataract surgeries, cleft surgeries, and really remote parts of the region. And I always kind of had this yearning to try and help people get the care that they need, get the access to health that they need, even without the resources to really support it. And that's what prompted me to quit my day job. I signed up for a master's in public health at Harvard, brought me out to the US 3 years ago. And the whole time I was in Boston, I was more drawn to the health tech ecosystem, the kind of innovation front here, hackathons and things. And what I wanted to do was kind of create a platform that could help to reduce the costs of health, even in the US, because there's a lot of underserved communities out here who can't get the care that they need. And the key to that is leveraging some of the mobile technology that we have available today. A lot of people have smartphones. There's health monitoring devices that are becoming cheaper and more ubiquitous. Our thesis when we started 2 years ago, when I joined forces with my co-founder, Jake, was to try and leverage these devices and leverage some of the behavioral science out there to sort of nudge people to make daily healthy choices with a combination of incentives and device data, and really kind of throw the book at the problem. And smoking made sense as well. I'd been a smoker for some time in the past, and I understood the problem, and Jake had seen the problem from the perspective of Medicaid and the payers from his previous life as a healthcare IT consultant. So we both had like very strong need to help this population, the more vulnerable end of the population.
So when you and Jay got together, then the intention was there, but smoking actually, specifically working on smoking, actually came after you connected with him.
Yeah, I mean, we see smoking really as a huge cost burden. It's sort of like one of the probably the biggest line item in the expense budget of, say, state Medicaid health spending, and but really, it's also a gateway to access people with multiple comorbidities. Smokers often have diabetes, heart disease, COPD, asthma, mental health conditions. All these factors play a role, as part of the social determinants of their health. As part of, smoking exacerbates all those things. And I think smoking is just the starting point for how we help people with all those, the spectrum of those conditions, with a similar concept of incentive-driven engagement and data-driven counseling.
So then, is the plan as the company evolves to use this to add into the counseling methodology some, the chance to diagnose or reveal other issues, and then potentially move them into other programs?
Yeah, that's the goal. In the medium term, I think we want to focus very intently on the smoking problem and really kind of tackle that vertical and build out the infrastructure as a result, because it's hard to build this vertically integrated value chain if you're trying to do a lot of things with it. I think focusing on smoking and delivering that care is relatively straightforward and manageable while we build out the more complex foundation. But definitely our plan is to go wider.
So coming from, internationally, moving to the States 3 years ago, I'd be curious to hear your thoughts. This is obviously a unique opportunity within the way our healthcare is structured. Do you see, pushing this out to other countries as, in some instances, being maybe a funded NGO similar to what you did before, or do you think you can also tap in and perform the same thing with state-run healthcare?
Yeah, 100%. I think, I come from a very international background. I've lived in about 7 different countries, 9 different cities throughout my life, and a lot of them are single payer systems, but with significant smoking issues within them. We are learning how to create the most cost effective smoking cessation program out there with the help of the US health system and the kind of fee for service mechanisms and structures within the markets that we're serving here. But our goal is to really use the data that we're collecting to be able to shift to a more risk-based model so that we can sort of say, okay, this is how much it will cost for us to guarantee these outcomes. And that approach will serve us well, even when we pitch to other single-payer environments outside.
So that becomes then sort of an ideal. You could conceivably ask for, if you have the data to support outcomes, then there might be some more discussion to be had about the payouts, because I'm assuming they're giving you lowest common denominator value at this point.
Yeah, exactly. I mean, what we have is pretty much a very flexible laboratory to run economic experiments to see how much does it cost to nudge people to do certain things depending on the nature of that person and the kind of information that we can have on them. And the more granular the data and the better we understand our populations, the more customized those incentive plans and those engagement drivers can be. And that principle can be applied to almost any other behavior and
Right. So then ultimately that probably will make you more profitable, because you'll find more effective ways other than just passing the money through to accomplish the same goal once you get the data.
Yeah, exactly. I think the better we can understand our population, the more efficient the payouts can be, and the more kind of adaptive and predict and preemptive they can be to drive the outcomes in the most cost effective way.
Right. So, not that they're exactly the same, but coming from an investment background, coming around the front end and raising capital, how was that for you? Was that a fun exercise, given your command of numbers in general, or what's that process been like?
I think the venture space and the startup space is very different to the leverage finance buyout space that I was in before. But I've been for the business model that we have, I've enjoyed building a very carefully crafted project finance type of financial model that's based on very specific identifiable revenue streams and billing codes and so on. So maybe I've kind of gone too deep on that front, but I've learned a lot along the way on startup financing and pitching and early stage fundraising, which is probably more an art than a science, and comes down to a lot of psychology more than finance skills, I think.
Very true. How did you come across the Tampa Bay Wave Accelerator?
Actually, we applied and pitched to the Accelerator last year and we got rejected. But Richard kind of saw something in us, I guess, because we were scrappy and hardworking and resilient, and he remained like a really close mentor to us throughout the year. And we made a lot of progress in the space of 1 year. Last year when we applied, we were still in school and we didn't really have much, just more of an idea. And since then we'd pivoted somewhat and we'd kind of grown the product. We'd learned how to do things better. And I think Richard played a big role in us to wanting to be part of the community, because he's one of the most hardworking, sincere, and well-connected, competent mentors that we've come across. And I think that to me is very valuable.
Did you have some specific goals upon entering the program that you're hoping to achieve or learn?
I think for me, connecting with the other founders. I think there's a very high caliber of startup founder in the cohort. Um, I feel like we're one of the younger, less experienced sort of seedlings, and you know, who have the great privilege of learning from a lot of very well seasoned entrepreneurs who are doing great things. So that to me is the greatest value. And I think opening up a new network in Tampa, further south, I think that's also really, really interesting.
That's wonderful. Cool. Well, I'm going to encourage you to consider, as before the weather starts to turn up there in Boston, to relocate down to Tampa Bay. That'd be a good choice. But either way, maybe they'll have an in-person demo day. And if so, I'll look forward to meeting you there. I've enjoyed the conversation and wish you the best of luck. And it sounds like you could do a lot of good for the world if you're successful and you're on the right path.
Yeah, thank you, Joe. Thank you for the opportunity. And for me, being able to start this company, move to the US, and just like dream big, I think it's been a huge privilege that I don't take for granted. And working with an incredible team who I wish I could, bring with me to these conversations. But yeah, a lot of gratitude on my end.